Hi, I'm Junior Hoops. I'm the Family Advocacy Program Manager here at ACS. Again, I'm going to be talking to you about our last tips of the day for this last week. This last week was on anxiety, and so we're going to talk a little bit about anxiety. We're also going to be doing more of a series of this for the next few weeks, talking about anxiety and some things we can do for it. So, what is anxiety? That's the first question. It is a mental or physical reaction that we have, and in small doses, it can be helpful. What it does do is it helps us avoid danger, and it could help us focus our attention on what is happening right then. The problem is when it happens too frequently or too often, it can become debilitating, and so that could be an issue. And so again, in small doses, anxiety, it helps us and can be helpful for us. But in a situation that we have too much of it, then then it gets out of control. Symptoms of anxiety. Now, some individuals will have this more than others. Again, you might have some, you might not have any. So just uncontrollable worrying is a symptom of anxiety. Poor concentration, increased heart rate, excessive nervousness, sleep problems, upset stomach, muscle tensions, avoiding fear. These are all things that come with anxiety. Now, there are different types of anxiety. Okay, so what you have is you have the generalized anxiety. The generalized anxiety is when you worry about a lot of different things at once, like going on in life, retirement, work, family, different things that are happening to you on a daily basis. That's generalized anxiety. Then you have phobias. Phobias are fears of different things that are going on in your life. So you might be afraid of spiders, or you might be afraid of different things, or have a phobia of high places. So again, these are phobias. And then you have panic. Panic is an extreme anxiety response when a person is going through having a panic attack. And sometimes individuals, when they're having these panic attacks, they'll describe it, especially if they have it for the first time, as if they're having a heart attack. And so these are some things that you're going to find. So generalized anxiety, phobias, and then panic. And then what you have is, what are the different treatments for anxiety? Okay, so what you have is you have cognitive behavioral therapy, or you've heard it as CBT. This is a great form of what you can do, therapy to help you through anxiety. And what this does is it helps you take your unhealthy thinking or your stinky thinking and try to look at it as how it can be irrational, or how it's gotten out of control, or just taking that thought process that you're having and turning it and changing it, and identifying it and then changing it for the better. Exposure therapy. Now, sometimes individuals, they absolutely want to get over these fears. Well, there has to be a reason why they want to do it. So they'll do exposure therapy. And exposure therapy, again, is just like it sounds. You're going to be exposed to the thing that you're most afraid of. Not all at once, but slowly. I knew somebody that was deathly afraid of clowns. She was afraid of clowns all growing up and never went to the circus or anything. And when she became older, she really wanted to take her grandchildren to the circus. And so she wanted to get over that phobia of clowns so that she could take her grandkids to the circus. And so she worked with a therapist, and they slowly integrated it with the exposure of it until she was able to go to the circus with her grandkids. Next one is relaxation skills, which is either deep breathing or muscle, tensing your muscles and then relaxing them. And then sometimes even with medications, so it can help. Generally what you're going to find is, though, meds are not going to fix the underlying problem of anxiety. So what will generally happen is if somebody's taking medications, they're going to want to have that going along with them seeing therapy. So that now that they're on meds, they're able to, that anxiety decreases a little bit, so they're able to do the cognitive behavioral therapy or the exposure therapy, so it helps them along the way, so they're not doing it by themselves. So again, these are just some tips that we did this last week. Please follow us on Facebook, look at our tips of the day for the last week, and follow us for other videos. And like I said, we'll be doing a series, and we'll be talking about cycles of anxiety and some different things that we can do. Like I said, my name is Junior Hoops. I'm the FAP manager here at ACS. Have a great day.